Hello, this is Olga and 5 minutes of Pilates for every day, and I'm happy to present you the new topic, side series. Today we start from beginner level. The first exercise for today is side lying. It will help you to master the stability of the body in side lying and also improve the mobility of your hip joints. There are no contraindications to this exercise. However, if you feel uncomfortable lying on the side, you can put something soft below your femur. Please lie on your right side. Put the lower arm under your head for support and stand the palm of your upper arm on the floor in front of your chest. The whole body is in neutral. The left ischium is above the right ischium, legs are bent, and the left knee is above the right knee. If you feel not enough stability, you can bend your knees more. Lift your lower leg until it is parallel to the floor and lower it down. Repeat this several times, keeping your whole body completely stable. Next time, when your leg is in the air, keep it lifted and start to move it forward to bending in the hip joint and backward to extension in the hip joint. Make sure that the angle in the knee stays the same and that the spine stays in neutral. Engage your abdomen to prevent lumbar spine from extending when you move your leg backwards. Straighten the left knee and continue bending and extending the left hip joint. Elongate yourself from the top of the head until the sit bones. The next time, start making 2 kicks of the straight leg forward and then 2 kicks backward. Stay on the side, avoid rotating the ribcage or pelvis. Straighten the lower leg, lift the left leg in the air and parallel to the floor, and start the bicycle movement with your left leg. If you feel enough stability on your side, you can take your left arm off the floor. Now change the direction of the bicycle, of the circle. And the last variation on this side, please straighten your upper leg and start drawing a circle with your foot. Stabilize yourself. Experiment with the diameter of the circle. Change the direction. Okay, take rest and lie on the other side. So change the side. When you are lying on your left side, bend your knees again, put the left arm below your head, put the palm of the right arm in front of your chest, and several times lift the right leg to parallel to the floor and put it down. Find stability on this side. Make sure that both sides are alone. Keep your upper leg lifted and start bending and extending it. So you move it forward and backward, keeping the angle in the knee. Next time, straighten your upper leg, bring it to the air and start moving it forward and backward, keeping the stability of your trunk, of your body. Make sure that the lumbar spine stays long, that the pelvis is stable. And next time start doing the double kicks. 2 kicks forward, 2 kicks backward. Engage your abdominal muscles when you move your leg backward. Next time straighten your lower leg and start making bicycle movements. This exercise helps to differentiate the movement of the hip joint from the movement of the pelvis and spine. And it also helps you to master stabilization of the lumbar spine when moving the legs. And of course, you will be prepared for more complicated exercises. Change the direction. If you feel enough stability, you can take off your arm from the floor. And next time start drawing the circle with your right foot, having the right leg long and straight. Change the direction. And next time take rest. The second exercise for today is called mermaid. And please avoid this exercise in case of sharp pain in the shoulders, spine, knee or hip joint. And if you have osteoporosis, do not go to the limits of your range of movement and avoid combinations of bending and rotation. Stay with one direction at a time only. We start in side sitting position. Your right shin is in front of you, your left shin is to the left of you, and left foot is directed backwards. Right sit bone is on the floor. If you have any discomfort, sit on a brick or a blanket. Spine is in neutral position and is vertical. Put your right hand on the floor on the right side. Elongate the back part of your neck. Bend yourself to the right, sinking your right arm into the mat and extending your left arm over your head. Keep both of your sides long. Imagine that your back is sliding along the wall, so you move in one plane only. Return back to neutral and lower your left arm. Next time start bending one time to the right, one time to the left. Keep your neck long and shoulders down. Next time you are bent to the right, stay there with your left arm lifted and start rotating to the right. Direct your left arm into the space between your trunk and the right arm. Now put both hands on the floor near your right knee. Start pulling the mat towards you and allow your spine to extend. Then start pushing the mat away from you and allow your spine to bend. Include the neck and the head into this movement. Take rest in the middle. Move both of your legs to the right side. Find a good support for your left hand to the left of you and repeat the whole sequence to the left side. Start with simple bending to the left. Then alternate. One time you bend to the left and one time you bend to the right. Then next time you Bend to the left, stay there, and add a rotation. So you direct your right arm into the space between your trunk and your left standing arm. And the last variation for today, for this exercise, would be with both hands on the floor. So you put both of them on the floor near your left knee and you start bending and extending your spine. This whole sequence of variations for this exercise increases greatly mobility of the spine in all directions. It improves proprioception of the trunk, improves the posture and breathing. It also prepares you for more complex exercises where you need the arm support. When you're satisfied, take rest. Hope you had a good experience today during this first two exercises of the side series for beginner level. And I would be happy to see you at the side series for beginner level part 2, and we will explore two more exercises.